Our department at the Royal Adelaide Hospital has 2 Biograph MCT flow PET scanners. We perform regular SUV validation scans on both these scanners with a cylindrical water phantom. In 2020, our average SUV results were 0.99 plus or minus 2%, averaged across both scanners, and the same for Gallium-68. So these results are all well within the 5% tolerance. We also have our own NEMA IEC body phantom, which we use to do quality assurance and accreditation scans. As you can see from the table here, with F18 we also have excellent SUV values of 0.99 and 1.00 respectively on our 2 scanners. We were therefore very surprised when we went ahead and did similar scans with Gallium-68 with the NEMA phantom, where, as you can see, the SUV values are typically sitting 10% high and clearly exceeding the normal 5% tolerance. So we were very puzzled by this, and it raises a number of questions. Firstly, why is this only occurring for Gallium-68 and not for fluorine-18? Secondly, why are we only seeing these overestimates with the NEMA phantom and not with the cylindrical phantom, which we have tested with both fluorine-18 and Gallium-68? And the third question, which we still don't really have a good answer for, is why is one camera worse than the other? We were able to rectify the issue on one of our scanners, as you can see there, which I'll explain a bit more later, but the other one remains a problem. After reproducing the results a number of times, we sent the data to the manufacturer, who were very proactive in looking at the results in detail. After a detailed analysis performed by their senior physicist, he came back to us with a diagnosis. The diagnosis was scatter undercorrection. When you look at the scatter fraction values reported in the DICOM tag of the reconstructed images, you see that for fluorine we have quite a high scatter fraction, 35% to 37%. However, for Gallium-68, when we're getting these anomalously high results, we're getting very low scatter fraction readings of 25 to 30%. So now we return to the question of what is special about Gallium-68 compared to fluorine-18. So the typical scatter event that we see with Gallium-68 and also with fluorine-18 is a direct positron decay. It proceeds as follows. So we have the Gallium-68 atom disintegrating, gives off a positron which annihilates against an electron, produces a back-to-back pair of 511 keV photons, and in the case of a scatter event, you have one of those is deflected or scattered by the object being imaged, and as a result you still get a detected coincidence, but the localization is off, so this adds noise to the image. Scatter events are very common in clinical PET images. Typically 30 to 50% of events are scatter. Now with Gallium-68 we also have this second decay route, where not only do we have positron produced, but we also have 1077 keV prompt gamma produced with the initial decay, and we then have 3 photons that could potentially be detected the prompt gamma is only detected if it is scattered such that it reduces its energy into the energy window. If that occurs, then you can get an event such as this, where you get the prompt gamma detected along with one of the annihilation photons, with the other annihilation photon not detected. And this gives another kind of scatter-like noise event, if you like. We can measure the amount of scatter directly using the NEMA protocol, typically performed at acceptance. In this protocol, the line source is inserted inside a perspex cylinder, 20 centimeters in diameter, and then a fit is performed to the cold region on the sinogram. And the assumption is then that any activity that appears to be coming from the cold or the region with no activity is scatter. And so this method is independent of reconstruction. So we've had a look at that on two different scanners. Firstly, one of the Adelaide scanners at acceptance, we found a scatter fraction of 33.5% with fluorine-18, and doing the same test with Gallium-68 yielded a scatter fraction of 34.9%, which agrees with the theory on the previous slide. Similarly, a different scanner by a different manufacturer in Hobart, I was able to test with both fluorine-18 and Gallium-68, and again we see that the Gallium-68 has a few percent higher scatter fraction. Of course, there's some difference between the values between the two scanner models, but that's not unexpected. Prompt gammas appear in most PET traces to some extent. Fluorine-18 really is the exception in being a very clean positron emitter with no prompt gammas. Gallium-68 has about 1.3 prompt gammas per annihilation event. Rubidium-82 is even higher at 14%, and zirconium-89 actually has even more prompt gammas than annihilation photons. So you wouldn't expect naively for the Gallium-68 1.3% prompt gammas to have a big influence, but it turns out that they do cause problematic effects next to high activity regions, and these are halo artifacts. And I've brought up a couple here from the literature from two different manufacturers. Here you see on the left image the halo artifact that results for not accounting for prompt gammas, and on the right hand image in each case you can see the improvement once prompt gammas are incorporated into the scatter correction algorithm. So how does the scatter correction algorithm model this scatter? So the typical sort of process is shown here, where you start with the true plus the scatter image as your initial estimate, then you simulate the scatter from that. You also simulate any prompt gamma scatter type events, and in our scanners there's also what's called relative scaling, where due to there being activity outside of the immediate field of view, they found it beneficial to fit to the tail, so the portion of the image that is outside of the image object, and through that adjustment that tends to improve the accuracy, at least with fluorine-18. And once you have this initial estimate, you can go ahead and subtract that from the true plus scatter that you started with, and you can continue to iterate that a number of times. The problem seems to be the interaction between these two steps shown in red. If you omit either one of them, then the problem seems to go away, but the combination of the two can often lead to a problem. So now on to the question of why was it only the NEMA phantom that we had these results and not the cylindrical phantom. So it turns out a part of the story is that with the NEMA phantom we often had the scanner bed out of the field of view. So you can see here on the CT image we have a foam sort of holder for our phantom, which it was supplied along with the phantom, and so that foam is quite high, so that in order to center the phantom we ended up with the bed sitting quite low such that the edge of it was outside the CT field of view, and that was a problem for both of our scanners and led to results that you see there of 11% overestimate of the SUV. But when we remove this foam holder so that we can move the bed up higher so that it sits entirely within the CT field of view, that was enough to address the issue with one of our scanners, and we were able to get consistently passing results. So we would have hoped that that would be the same for both scanners, but unfortunately, even with the scanner bed well within the CT field of view, we continue to see this scatter underestimate on our other scanner. It seems that the scatter algorithm has a special trimming function where if it detects truncation in the CT image, then it excludes some of those projections in the sinogram or lines in the sinogram from the fit it does to the tail of the scatter. So how do we go about solving this issue? So in terms of adjusting the algorithm, there are two options. We can remove the prompt gamma correction and keep the relative scaling option. Of course, that risks bringing back the halo artifacts. The second option is to use absolute scaling, where we bypass this relative fit to the scatter tail. So the plan was for both of these to be provided with the new software version VG62C, which has been released to us earlier this year. Unfortunately though, when we've tried out the software, we haven't been able to produce any images with absolute scaling, and with relative scaling we haven't seen any change to our results, so it's not clear whether the prompt gamma has been taken off of that or not. So we're continuing to work with the vendor on progressing that. The other option available is a paid upgrade to software version VG70. So the new algorithm of this, as I understand it, uses other bed positions in the scatter estimation, so that would therefore negate the need for the relative fit to the tail, as you have all the information if you're doing a whole body scan of the whole patient. It may still be an issue though if you're just doing a brain acquisition or something like that. So in conclusion, fluorine-18 accuracy does not always translate to gallium-68 accuracy, as illustrated in this example. Scatter correction algorithms are complex and they warrant careful examination across a range of conditions. And in cases like this, software flexibility is important. It would have been great to have similar flexibility that we have with our, for example, SPECT scatter correction algorithms available here in order to somehow mitigate some of the anomalies we saw here. Finally, I'd like to thank Mike, Amanda and Adam from Siemens Healthineers for thoroughly investigating the issue and for helping us in our search for a solution. Thank you.